Hello, everybody. Greetings from Confederation of Medical Association of Asia and Oceania. This is our 29th meeting. This is our 29th meeting. And for me, for CMAAO, this is 821st meeting ever since I have taken over. We are putting a disclaimer now in our future shows that this meeting, which is now coming as a requirement of a social media, that this video is only for educational purpose and backed by research and data. And whatever views we take it up are the views of NMAs and scientific views. And we are not propagating anything which is unnatural, unscientific, or not based on any fact. Can we take the, yes. So today we will have two subjects. I wanted to know the update from every country so that we can, it is almost like a year is over of the illness, we can have an update. But before that, we wanted to discuss the issues raised by Trump's illness, because there are multiple issues which have been raised by Trump's illness in his diagnosis, in his treatment, as well as prevention and public health aspects. So I'll take the public health aspects first. The public health aspect is, normally we say 14 days quarantine for close contacts and 10 days isolation, which we did not see with the president and the vice president. So can we break the rules? Okay. Is it possible that if you are a VIP, then the rules can be broken? I remember in India, for breaking the rule, one had to approach a Supreme Court, that a person wanted to give an exam, he was COVID positive, and the Supreme Court gave directions that yes, he can give exam, but then he will be not sitting in the examination hall. He will be made to sit only in a separate room and can give an exam. So that type of a level of regulation is required. But let us see what happened in America. So I want to show you one slide. So this picture, if you see here, this is my data of patients. If you see left eye, left eye, left eye, left eye, left eye, left eye, and left eye. If you see, everybody has a left eye conjunctivitis. 1, 2, 3, 4, 5, 6. These 6 are positive confirmed cases of COVID-19. They all develop COVID-19 positive with left eye conjunctivitis. This is the Vice President of America. You can see here, this is the left eye conjunctivitis. Mike Pence is the left eye conjunctivitis. That means it is possible that if you are a VIP, you have classical COVID conjunctivitis, there is a definitive history of contact. There is a history of contact, and even then you are allowed to move in a car, fly in a plane, go back to a meeting and debate. Now this is one matter which is a which I feel as a CMAAO countries, we need an opinion of all the people here. Was it right or not? His physician at the White House told the CDC that he had no history of contact. That means they even missed the left eye conjunctivitis. This picture of left eye conjunctivitis, I picked it up from his debate when he was giving a debate, and now it is flooded all over the world. Every media is trying to carry, is he having a left bloody eye? Is he having a left bloody eye? So he is suffering from COVID-19, but he is moving around in his campaign. The second thing is Trump himself came out, took the mask out, entered a room, had a meeting with all the people not wearing a mask. So these are two issues as far as prevention are concerned. Coming back to treatment and diagnosis, the very fact so many people in White House developed COVID infection, that means there is no protocol. Otherwise, the virus would not have spread at least to the White House. This is again a VIP syndrome that we cannot get it. I mean, out of 25, 12 people getting and 10 not getting infection, 12 people getting positive on day one when they tested for RT-PCR is significant. That's true. Regarding his treatment, it's important to understand he received vitamin D. We are also giving. He received zinc. We are also giving. He received remdesivir. That means he had hypoxia, because there is no indication of remdesivir without hypoxia. And that's a classical indication that he developed moderate to severe disease. He received remdesivir. He received steroids, which is a classical indication for, that means either he had a high CRP or he had a high IL-6. Therefore, he was given steroids. Otherwise, there was no reason. He was given famotidine, because now famotidine, they say there is a role in COVID-19 with that. So he practically received, he did not receive hydroxychloroquine, for which he has been advocating himself. He received statin, which is a standard treatment in COVID to reduce the inflammation. He also received a monoclonal antibodies, which is a concentrated form of plasma therapy, which is a new thing. The trial is yet to be there. So he received a cocktail of a monoclonal antibody, remdesivir, steroids, low molecular weight heparin, statin, zinc, famotidine, and vitamin D. That was his treatment. Now this treatment will tell you that whether it is Bangladesh, whether it is Malaysia or India, we are following the same strategy, and the same treatment is being followed anywhere in the world. So open for discussion as far as Trump's illness is concerned. And after that, we will like to have an update of every country and debate on every country's presentation. Jamal.
I just told you that it was actually Trump side was telling that he may be having the symptoms before he went for test. So they are trying to just support that idea that he can go now to the public, he can meet the public. That is what they are telling. I heard from BBC or something like that. Number two, I just want to know that this is a plasma therapy, monoclonal antibody, just taking plasma from the
No. Monoclonal antibodies are prepared by taking the antibodies and then converting and preparing separate antibodies and concentrating them. It's a drug now. Monoclonal antibodies.
It's a drug. So he has taken that. I think.
He has taken that drug.
He has taken that
monoclonal antibodies, but they are the same. They work on the same principle as that of a plasma therapy.
Yeah.
In plasma therapy, you are giving them the whole plasma. Here, you are giving them only monoclonal antibodies. It's a drug.
That's the thing. So the other thing, you are telling about the Mike Pence. Actually, Mike Pence didn't go for test. So far I know. So I don't know. He is a contact, but how he has overruled this that he doesn't need this test. He hasn't gone for the test probably,
He hasn't
and
gone for the test, and he's positive. His
uh,
left eye is
yeah,
conjunctivitis.
yeah. But
He's
but
hundred
but
percent positive. I have no doubt that he is not suffering
oh,
from COVID.
that's fine. That's fine. So that is that really there is a question. Actually, it will give the wrong message to the
So
people.
therefore, our medical fraternity answer has to be very clear.
Yeah.
That don't go by the VIPs, follow the medical
Yes.
advice.
Yeah. Yeah.
That
Can I?
VIP message should not go to the public, that you can behave like you can leave and go for debates, because otherwise what will people will say is, if Trump has gone for a debate, why can't we go? Allow us
So
to leave.
so my another question. My one question is that I have not gone through this here. Why it is left sided conjunctivitis? Is it specific for? Yeah. Is there any explanation?
I said, this observation we have seen in India. Nobody in the world is talking about it at the moment. This is an observation that we are finding left eye conjunctivitis. 9 out of 10 will be left eye conjunctivitis. We have no answer. There, ophthalmologists give some answer, but I don't know. See,
Oh,
there is no answer for why COVID-19 is not causing hoarseness of
right.
voice, why it is
Oh,
not causing pleural effusion or pericardial effusion, why
yeah.
it is not causing mediastinal lymphadenopathy, why it is not causing arthritis. These are some unknown questions, including why it is causing only left eye conjunctivitis.
Is there any answer to this here? This remdesivir should be given only to the person who is requiring the oxygen, supplemental oxygen.
That's
Why
what
not
the
from the beginning? Why not from the
no,
beginning they can start?
no. That's what the FDA approval is for.
Yeah, I know, but what is the
See,
reason actually?
see,
If it is antiviral, why it's not working in the mild phase? There is also viruses there, so
I'm
that
saying it is approved for approved for people who are getting infection with hypoxia. First evidence of hypoxia, shoot remdesivir. Whether it can be given earlier, theoretically yes, medically yes, but then shortage of drug may be the problem. Then everybody will receive.
but I think you have gone through this information also that the Trump's partial pressure of oxygen also gone down twice
Twice.
up to the 93. So
Therefore, they
it is
gave him
justified.
remdesivir.
Yeah. That's it.
They gave him, and steroids were also justified. The side effect steroids were given. So remember, steroids are only given if you can demonstrate cytokine release, and the evidence is CRP or IL-6. You cannot give a steroid without a cytokine release.
Yeah.
My question, Dr. KK, how come Trump is out of hospital in 3 days or 4 days?
That's what we are debating. That's what we are debating, because
So,
you are allowing him to go. You are allowing him to go outside
yeah,
and campaigning, which is
yeah,
breaking the isolation laws. That
yes,
this can break. This is what we are saying. This is what you also are saying in Malaysia, because PVIPs broke the law. This is what we are
yes,
worrying. This is what we are now worrying in India in the
mhm,
Diwali Dussehra festival season. If everybody
yes,
breaks the law, the infection will spread.
that's right, correct.
That's what we are talking about. The issue today is that one should not take that Trump is not a example to be quoted, that if Trump can do it, I should also do it. That's what the message
Correct.
is.
I think the message should be, like you said just now, do not follow the politicians. Follow the medical advice given by the Director General of Health or whoever is there in each country.
That's
Uh,
what yes.
yeah. Hello. Good afternoon. Thank you, Dr. Aguavo. I would also like to echo what you have said about the misbehavior of Donald Trump. So, in fact, even Dr. Fauci had objected modestly and politely against his behavior, because it's usual for every country to have the quarantine and the isolation. And then for this disease, it is notorious that it could have reinfection, and it could have at least a week's shedding of the viruses, even though he himself has recovered. And so Dr. Fauci had also mentioned that he should have 2 consecutive negative specimens from himself for 24 hours apart, both being negative. Then perhaps they could let him return to his White House office. But now, obviously, he had not yet done so. And prematurely returning to the White Office, he had the danger of spreading to other offices. So this is the first thing. And the second thing, I think, is more complicated to say that we have to follow the politicians, not to follow the politicians, and then to follow the government's medical advice. Still, even this one, we have some polarization of government's measure. For one thing, Swedish government is the one that's following their chief epidemiologist and have nothing proactive to implement in Sweden. And well, that is against all odds. All the countries in the OECD are not doing like what they are doing in Sweden. And yet, even for the rest of the world, there is the Great Barrington Declaration. The Great Barrington Declaration is against the stringent or proactive measures, the social distancing and all those limitations in social gathering, etc., and including some well-known experts in the world, and they joined to sign the Great Barrington Declaration. And I think that caused a little bit of confrontation in the medical world. So who to follow? And thirdly, I am sorry to say, not only Donald Trump had demonstrated a very bad misbehavior in going back to the White House prematurely, he had taken off his mask very carelessly and put that face mask into his pocket. But this is not him alone. His doctor in charge in the military hospital had done the same thing in the press conference. I observed 2 times. 2 times his physician in charge had taken off his mask by his hands and then put into his own pocket of his coat.
Yes, yes. I saw
And
that
that
too.
is and that is a
funny
very
thing, actually.
a very bad demonstration. And he had not used his alcohol sanitizers to clean his hands, you know. And I think we could also voice out that, in fact, as doctors, especially, they are so prominent. They are treating Donald Trump and having the press conference that everyone in USA and even outside USA, well, so many people are watching, and I think that is quite careless. Yeah, thank
So
you.
I just want to say is that if the same thing was with a doctor, would they not have allowed the doctor to do the same? If a doctor was attending his patients, wearing the mask out, or like the vice president with the left eye conjunctivitis, seeing his patients, it would have become a misconduct by now. So let's have now the second part of our day today. We would like to know the update from every country, starting from Bangladesh.
Mr. President, can I add in the first half?
Please.
Okay, thank you very much. Good morning, everybody. Actually, I totally agree with Dr. Alvin. What he said about the behavior of the Trump is absolutely right. I endorsed him. But just I wanted to add something that I joined late. I don't know, somebody has already pointed out or not, that Mr. Trump has ordered or advised the doctors that prescribe this medicine, which is very unethical. So the politician should not advise medicine or suggest medicine, or like Trump, he is a president of a states. He should be very careful for for taking for giving any advice something particularly regarding the COVID-19. He should just advise for SOPs only, but he cannot prescribe the medicine. In the beginning, he confirmed that people should use hydroxychloroquine. It's a very good drug in the beginning. So that this is not good for all the politicians, rather in America or everywhere in the world. So this is the department of the doctors, the specialists, or the concerned doctors. So they are supposed to advise the concerned medicines. Thank you very much.
So we can start with the Bangladesh.
Oh, thank you. Thank you so much, Dr. Agarwal, President Simo, and my distinguished colleagues in the Simo. In Bangladesh, actually, the thing is that I already just informed, probably just started before the start of the meeting, that now the daily number of cases, positive cases, officially recognized as near about 1,400, 500 like that, and the number of deaths has just reduced. Officially, it has so less than 20 now, just 19 or something like that. Sometimes it's 25 like this. So the thing is that the government is not just advocating, uh, just advocating the people to use the mask and other sanitization, the program, and they are asking to follow that health advice, but they are not strict in the control. Actually, they are not imposing any law or something like that. So the people in the street, more than 50% people, they are not using the mask. So it's just, I don't know, and this is actually continuing for more than 1 month, like that same number of cases and like this. So government, we think the government should intervene and just impose that they have to wear the mask and others, so that otherwise it will continue like this, something like that, 1,000, 1,500. It will continue, and maybe the people also not interested to go for the test, and so that may be also the reason for this figure actually. Thank you.
Dr. Agawa,
Yes.
can I follow Jamal? Because
Yes.
I will have to have a teaching session in 1:45. So perhaps I could follow Jamal to report
Yes.
our situation in Hong Kong. Thank you. So, Mr. President, in Hong Kong, we have now been at the verge of a fourth wave coming to Hong Kong. So in the past 1 week, we have every day some patients confirmed to have COVID-19 with unknown origin, although they are still in the single digit. But we are very worried because there are quite a number of then accumulated unknown origins. And that is very detrimental to our plans to recover our economy. By the way, one of the clusters that had emerged with the unknown origins and the cases are the bars. The bars we had reopened since 1 week ago, and yet there were known to be customers and also workers, illegal workers in the bars coming from Thailand, and that were confirmed to have COVID-19. And this is very dangerous because the bar was called China Secret. Now, you see, most of these so-called confirmed customers, they might be reluctant to reveal who they had close contacts or even intimate contact. And that is quite worrying because if they didn't reveal the contacts and just say that they have unknown origin. I think that is one loophole that we could not detect the context, and so could not really have the mitigation. So the Hong Kong Medical Association have been now drafting a letter to the government, urging them to have stringent and more proactive restriction and regulation of the bars and karaoke's, etc., in Hong Kong, and especially to find out any more illegal activities of those, visitors who might come here for tourism or any other purposes, but overstay, for example. But then, if they are doing those illegal activities and spread out the COVID-19, that would be most unfortunate. Of course, we don't have the evidence yet, but we have to be much more diligent and proactive, vigilant in detecting the source. I think so far we don't have too many, only a single digit confirmed cases every day, but that is worrying enough for us. And we also have to urge the government not to allow exemptions of the testing for those who are at the borders coming to Hong Kong. So we hope the government would really listen to us. Thank you very much.
Can I come in now, Mr. President?
Yes, please.
Okay, in Malaysia, what has happened is the government has enforced a law on social distancing, wearing a face mask, and every place you enter, any shop, any dining, any mall you enter, you need to register your name and your contact number. So by this, in case if there is any case that has been located in that area, they can do the tracing very easily. We had a by-election in one of our states called Sabah a couple of days ago. And that is where everything started, because many politicians and even voters went from Peninsula Malaysia to Sabah. And when they came back, they brought back many cases. As of the day before yesterday, we had 691 cases, fresh cases. The day before that, the day before yesterday was 489 new cases, and yesterday was 375 new cases. And in the last 2 days, there have been 11 fatalities. There are about 20 patients on ventilators, 60 in ICU. So it is actually quite alarming. Probably this is the third emergence of this thing. Yes. Yeah. Hello?
No, it's okay. Go on, please.
So it is quite worrying, in fact, now. So the government has still not done a lockdown. What they are doing is they are doing restrictive lockdown in areas where there are many cases. That area, there is a lockdown. They're not locking down the whole country, because the Prime Minister himself, who came back from that by-election, has quarantined himself for 14 days in his own residence. And many of the politicians did not observe this requirement when they came back to Peninsula. They just walked through and did not go and quarantine themselves. There's a hue and cry by the public, and many of the politicians have been sort of ridiculed to say that they are not following SOPs. And so now the government is actually quite worried because the cases are spreading, but they are forming lockdowns in certain areas where there are clusters. As of yesterday, there were new clusters. Many new clusters are being formed, especially from Sabah. So this is the situation in Malaysia right now.
Thank you. Pakistan. Doctors, Pakistan, Japan in the meantime.
Okay. Sorry, I was not mute. Now, can you hear everybody?
Yeah.
Yeah, thank you very much, Mr. President. In Pakistan, from the last 2 months, the number of cases was going down. It was very good, and we was expecting that it is going down and it will settle down. But from the end of this September, now again the cases are increasing day by day, and today we have 692 cases registered according to the government officials, but unofficial cases are more than that because people are not going for test, corona test, CPR, PCR, or other tests. So the cases are increasing day by day, but it's still not a problematic situation in Pakistan. Uh, in Sindh, comparatively, the Sindh province is much higher cases as compared to the other part of the country. So the death is also very low. Six deaths in 24 hours is recorded. Uh, but the situation is, and the worry is from the association is the majority of people are not following the SOPs, not following any instruction given by the doctors. The people are in view that the corona is now going from the Pakistan. There is no corona in Pakistan, so people are started shaking hands, hugging each others, and there is no social distancing. We are just observing. So this is very alarming. Maybe the cases will increase, and maybe the again situation will occur as previously, that the load on the hospitals and the healthcare workers will increase, and we have not a good infrastructure of health in Pakistan. So this is the situation in Pakistan.
So one thing is clear so far, that number of cases reduced down if you take precautions. The time number of cases increases, everybody starts taking precautions. Number of cases reduces, people stop taking precautions. That's the observation in every country, that if you take precautions, you can control the disease. And if you want and you require only next 3 to 6 months precautions, 6 months precautions have been taken. And if you take another 6 months precautions, we hope some vaccine will come. But otherwise, what happening is, whenever you lose down your precautions, the number of cases will increase in the society. Japan?
Yes, thank you. Thank you always. In Japan, there was an internal presentation in the registry study. The first and second waves were compared. There was reduction in mortality in every generation of hospitalized patients. There were no deaths in the patients under the age of 69. I will share the detail of what treatment was given and other information when it is published in English. I heard that combination of RDT for severe patient, combination of remdesivir, dexamethasone, and torimacil reduces mortality, and they will publish paper in near future in English. And Dr. KK, I have a question that you stating that the left finding of the conjunctivitis in the left eye is quite interesting. Have you studied the patient is right-handed or left-handed?
In India, all of these people are right-handed. Is Trump a left-handed? Is Trump a left-handed?
Mm-hmm.
I know.
I see. So, thank you very much for the information.
Welcome, Dr. Chong. Welcome. So, Dr. Chong, we have discussed so far two things. We have discussed something on Trump's illness, And the second agenda was we are taking updates from every country. In the Trump illness, we have spoken about a couple of observations. A, he is taking his mask out and keeping it in his pocket. Second, his physician, while giving a press conference, also took his mask out and put it in his pocket. Three, the vice president clinically has COVID because of left eye conjunctivitis, yet he was declared as non-contact. I mean, there is no point of whether there is no, when you have obvious symptom of COVID, what was the idea? And the fourth thing we was talking was, can you be on a duty before 10 days? Because they would not allow that to a doctor. Can a doctor be on duty before 10 days of illness, before completing his quarantine? These were the questions we raised. And then we are taking updates of various countries because there are resurges, there are surges in many countries, including Malaysia, where wherever you allow gathering, the number of cases are increasing. In India, wherever festival relaxation were given, number of cases increased. So, Dr. Cham.
Thank you, President. Just to update what's happening to Singapore, we have brought the dormitory outbreak under control. As of yesterday, we only had one case in the dormitory, and we had 0 in the community. And the rest were imported cases, 9 of them. So altogether 10 cases, but 9 were imported, 1 in the dormitory and 0 in the community. And we are swabbing all our foreign migrant workers, 300,000 of them every 2 weeks to keep the situation under control. So we have let them gone back to work, but they are being swabbed 300,000 every 2 weeks. So that's of the order of divided by 14 days is about 20,000 a day that was swabbing of the migrant workers. So far we've finally brought the thing under control, the infection under control. As of today, we have about 58,000 cases in total. So the majority of them are migrant workers, about 56,000, and maybe 2,000 in the community, and some imported cases that have come from everywhere. So that's to update Singapore. We're actually trying to open up travel now, cruise ships and air travel bubbles between certain countries. So that's what we're trying to do to try to open up the economy. Of course, being very, very careful, looking at the experience of all the surrounding countries and all the countries in the world. Thank you, President.
I want to show you 2 videos if possible. Let me see. This is what we have shown as left eye conjunctivitis, including the vice president having left eye conjunctivitis and giving a presentation. Then we have Trump using his mask correctly, nose open. So he says the mask should be used only in the mouth, not in the nose. Classical. Then we can see him removing the mask. And then we can see him, if I can show this video. This is from New York Times. I want to show 2 videos. These are classical ways how to remove this is a demo to be given to how to remove your mask.
But what about the Dr. Kagrawal, what about the airborne transmission? Actually, some research actually from the UK just told that it says airborne is also possible.
See here, yes, yes. See here. So this is correct. This is correct.
We can't see the video.
You can't see the video.
No, we can. Okay.
So you can or not?
No, we cannot.
You cannot. So how to do it?
Send me the link. I will show you.
I'll send you the link right away.
Send me the chat.
सौरभ, ये वीडियो गया नहीं है आपके पास में. I'll have to send you the because you
Send me on the chat.
send me in the chat. Both of them you have to show one by one.
Okay, I got it.
As we overcome the pandemic, won't we have a better chance of generating limitless energy when we work together? At SABIC, we believe the chemistry between
It's
people
not coming.
is the chemistry that
No,
matters.
so the video is not coming. Just we are just listening the audio. Audio, yes.
First Lady.
Video is not coming.
Video is not coming. Yes.
Families are dealing with COVID-19.
Somebody else is playing that.
See the president
Mine is just playing.
Video is not coming.
over the weekend. Now that he's busy tweeting campaign messages, I would ask him to do this. Listen to the scientists. Support masks. Support a mask mandates nationwide. Require masks in every federal building and facility.
अपना बंद कर दो, आपका वीडियो चल रहा है.
On Friday, more than 100,000 since Friday, more than 100,000 more people have been diagnosed with COVID. And this week, at least 5,000 more will die. Cases and deaths are
आप
climbing.
अपना क्लोज कर दो लिंक.
President's recovery.
So everybody can see my screen now.
Yes.
Screen is there, but no video.
Screen is there, but no video.
Yeah, now the video will come.
Now see this doctor. See this
it will come.
doctor. And he will start addressing his press conference. He's an ideal doctor of the world. So he starts his.
Here's Dr. Conley, Commander Conley, and we're going to listen in.
Yes, he removed the mask.
Remove the mask and put it in his pocket.
Pocket, yes.
He put it in his pocket.
Yes, Dr. Trump.
Yeah.
Dr. Trump.
24 hours, the president has continued to improve.
And come back to the second one.
Exceeded all standard hospital discharge criteria.
The second one.
Another dose of
First one. That is important.
Yeah.
New York Times is an excellent newspaper.
इसको वो कर दो.
I don't know what happened.
Mr. President, while the video is coming, I just ask a question that the doctor is has removed the mask, but can he can do that? Why not?
No,
Because
he's putting in his pocket. He's putting in his pocket.
In pocket. That the objection is in pocket. Yes. Yes. Because he nobody is in front of him, so he can remove the mask.
He is putting it in his pocket.
Yes, this is the point. Right. Okay.
He should have
fine.
given it to somebody. He is putting it in
Somebody
his pocket.
or yes.
Then he is going to reuse it.
Yes.
If it is putting in his pocket, he is infecting the pocket.
Yes.
That's what we are talking. And that you will see how once we see the Trump.
And no, because we say that you should not.
And the Trump did this same thing.
No, Trump is doing the same thing. Let's just wait for him.
No, about the mask, actually, you should not touch the middle of the mask. This front, mid front. So what he's doing, he's putting in the pocket and he's just touching there when he reuses the mask. That is the thing.
Yes.
Okay.
I don't know, something wrong with the.
Okay, forget it. Let us go somewhere.
I'll do that again. Wait.
Yeah.
So this one is important. This video is very important because
Yeah, you continue. I'll just do it for a second.
Yeah. So, Dr. Agarwal, I just asking you about the airborne transmission. Is there any specific information regarding this airborne?
See, airborne infection is, no, this one, this video is another video. I'm sending it to you. So airborne, I just answer back. Just ये हुआ कि नहीं हुआ? न्यूयॉर्क टाइम्स का?
नहीं, मैं कर रहा हूँ.
Anyway, so when we talk about airborne, but CDC has clarified it that when in a closed atmosphere, airborne is important, not in the outdoor environment. So in an indoor,
just 2 or 3 days back, actually in BBC, somebody from UK was just a researcher. He was telling that yes, it's very much possible, and he just informed.
It can't be possible outside in an open air with a ventilated room. They all are talking about ill-ventilated atmosphere. Airborne.
And what about an air-conditioned room? Yes, in an air-conditioned room.
That is ill ventilation. No? There is no natural ventilation.
I think one of the interesting things that I read about, for example, aircraft, is that the modern aircraft has air exchanges of 20 to 25 times per hour, far exceeding that of isolation rooms. Our NCID isolation rooms in Singapore is about 13 to 15 times an hour. So I think air exchange is the concept. If the air exchange is good, as in outdoors, it's pretty safe. And in a modern aircraft, actually, the air exchange is pretty high. So maybe one can think in the terms of the concept of air exchanges. Thank you.
What about the split type of air condition in terms of this air exchanges? Split type.
No idea. Have to go and find out. But I think if you're talking about clean room technology, they can do air exchanges. But I think air conditioners don't do that very well. Air conditioners don't do that very well at all. It has to be clean room technology. So thanks.
क्या नहीं हो रहा क्या?
Dr. Agarwal, what is the stage of this Indian vaccine?
Indian vaccine is in phase 2 still. Phase 3 it is going to go. Show this. We have inactivated vaccine. नहीं चल रहा?
Error आ रहा. आप एक बार try करो अपने end पे, because I think मेरा system slow experts है. That's why.
Take it out. Take it out. Take it out. If I can see the. If I can see the. I've not been able to see the. How do I pick up a? Yes. Can I see now?
Yes, but this is the other one.
No, but can I see the?
Yeah, we can see. We can see.
C-SPAN, your unblinking eye on politics.
We take you live to Walter Reed, where officials are about to give an update on the president's condition after testing positive for the coronavirus.
See, and he puts in the bucket.
Yeah.
That's what is one, and the second one is.
Over the past 24 hours, the president has continued to improve. He's met or received all standard hospital discharge. He'll receive remdesivir here today.
The second one is.
It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturation.
Mr. President.
That's just 1 second. Give me 1 second. That's important because why I'm saying is this is the second. This video is very important. I know this is. Yes. Is it seeing now? Can we see?
No,
just
no,
start.
it's coming. Yes, yes.
Yeah.
Now see.
That you have seen. I knew this earlier.
1, 2.
Yes.
See.
Remove. Yes.
So he touches his everything in the body. He touches, and then he says like that.
And by face, he is not comfortable.
He is breathless.
See? Breathless, yes.
He is breathless. He is breathless. See, he is touching every part of his body with the infected
mask.
Again, he is putting his hand in the pocket. So what I mean to say is these gives wrong messages to the society. That's only I wanted to bring it. Because we must say that this is fine for him as an individual, but
my prayers continue with the President and First Lady for their health and safety.
Yes.
So many American families are.
Yes, Sajjad, you want to say something?
No, never. Just I want to take a permission from you, sir. I have to go to hospital.
We are
It's
closing.
already.
We are closing the meeting. We are closing anyway. We are closing the meeting. So today our intention was that VIPs are VIPs. Medical information must be followed, and we do not recommend to the people that follow the politician Trump, and that's not normal. Whatever he has shown is not normal, and we even shouldn't project it to the society that can be normal. And I just wanted to add one thing before I close. Like there are ads before every cigarette or before every alcohol in a movie that it is injurious to health. Should we propose a statement that whenever somebody is showing in a movies, people who are not wearing masks, should there be a statement in the down that not wearing mask in public places is injurious to health? Only one statement: not wearing mask in public places. So at this moment we are not in public places. We are in our room, so we are not wearing a mask. So not wearing a mask in public places is injurious to health. That's a statement I wanted if somebody has any debate. Otherwise, this will be the key point of the day. Not wearing in the mask should be injurious to health, should be a disclaimer whenever we have any meeting.
Yes.
This can be a CMAAO disclaimer. So I like Dr. Chong to close the meeting.
Thank you, President, and apologies for my lateness to coming to the meeting. But yes, it is very alarming to see that the leader of the so-called free world has really made a mockery of science and has endangered the lives of his citizens and resulted in 200,000 Americans dead. It's very, very sad to see such behavior from politicians. And yes, as doctors, I think we have to keep reminding our people and our various constituencies and our population that, look, these are all bad examples to follow. And we should always to listen to science. And that's the basis on which we are handling this pandemic. Thank you very much, everyone, for attending the meeting, and always a pleasure on Saturday morning to see all of you.
We'll all meet next Saturday. Thank you very much. Enjoy a cup of tea, courtesy Singapore.
Thank you very much. Thank you very much.
Thank you very much. Bye.
Thank you.